Understanding pneumonia, an overview. Pneumonia is a common yet serious lung infection that affects millions of people worldwide each year. It can be caused by various pathogens, including bacteria, viruses, and fungi. This infection can lead to severe health complications if not treated promptly and effectively. Pneumonia is a serious lung infection. It primarily affects the alveoli, which are tiny air sacs in the lungs where the exchange of oxygen and carbon dioxide takes place. When these air sacs become inflamed, they can fill with fluid or pus, leading to difficulty in breathing and reduced oxygen intake. It inflames the air sacs in one or both lungs. This inflammation can cause a range of symptoms, from mild to severe, including cough, fever, chills, and chest pain. In some cases, patients may also experience fatigue, nausea, and shortness of breath. These air sacs, called alveoli, are crucial for breathing. They play a vital role in ensuring that oxygen enters the bloodstream and carbon dioxide is expelled from the body. When pneumonia strikes, the normal function of the alveoli is disrupted, making it challenging for the body to maintain adequate oxygen levels. They become filled with fluid or pus, making it hard to breathe. This fluid buildup can lead to a persistent cough that produces phlegm or mucus, which may be green, yellow, or even bloody. The presence of fluid in the alveoli also makes it difficult for the lungs to expand fully, causing a feeling of tightness or discomfort in the chest. Pneumonia can range from mild to life-threatening. The severity of the infection depends on various factors, including the type of pathogen causing the infection, the patient's age, overall health, and the presence of any underlying medical conditions. In severe cases, pneumonia can lead to complications such as respiratory failure, sepsis, and lung abscesses. It is especially dangerous for infants, young children, older adults, and people with weakened immune systems. These groups are more susceptible to severe forms of pneumonia and are at higher risk of developing complications. Therefore, it is crucial to take preventive measures, such as vaccination and good hygiene practices, to protect these vulnerable populations. Recognizing the symptoms early and seeking prompt medical attention is vital for effective treatment and recovery. Early diagnosis and appropriate medical intervention can significantly improve the chances of a full recovery and reduce the risk of complications. Treatment may include antibiotics, antiviral medications, or antifungal drugs, depending on the cause of the infection, along with supportive care such as oxygen therapy and rest. Causes and risk factors of pneumonia. Pneumonia can be caused by various germs including bacteria, viruses, and fungi. These microorganisms can invade the lungs and cause inflammation, leading to the symptoms associated with pneumonia. The most common cause is bacteria, particularly Streptococcus pneumonia. This type of bacteria is responsible for many cases of bacterial pneumonia, which can be severe and require prompt medical treatment. Viruses like the flu virus can also lead to pneumonia. Viral pneumonia can occur when a respiratory virus spreads to the lungs, causing inflammation and fluid buildup. Several factors can increase the risk of developing pneumonia. These include age, with infants and older adults being more vulnerable. The immune systems of these age groups are either not fully developed or weakened, making it easier for infections to take hold. A weakened immune system due to conditions like HIV or medications. Smoking damages the lungs and impairs their ability to fight off infections, significantly increasing the risk of pneumonia. Chronic lung diseases like COPD and recent respiratory infections. People with chronic lung conditions have compromised lung function, making them more susceptible to pneumonia. Additionally, recent respiratory infections can weaken the lungs, creating a favorable environment for pneumonia to develop. Other risk factors include chronic illnesses such as diabetes and heart disease, which can weaken the body's defenses against infections. Being overweight or underweight can also affect the immune system's ability to respond to pathogens. Hospitalization, especially in intensive care units, can increase the risk of pneumonia due to the presence of more virulent strains of bacteria and the use of ventilators, which can introduce pathogens directly into the lungs. Preventative measures such as vaccination can significantly reduce the risk of pneumonia. Vaccines are available for some of the most common causes of pneumonia, including Streptococcus pneumonia and the flu virus. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, can also help strengthen the immune system and reduce the risk of pneumonia. Elderly patients with pneumonia are at an increased risk of severe complications. Early intervention and tailored physiotherapy management are crucial to improve their outcomes and aid in recovery. Understanding the causes and risk factors of pneumonia is crucial for prevention and early treatment. By being aware of these factors, individuals can take proactive steps to protect themselves and reduce their risk of developing this potentially serious condition. Recognizing the symptoms of pneumonia. Pneumonia symptoms can vary depending on the cause and severity of the infection. Some common signs include cough with phlegm, fever, chills, shortness of breath, chest pain that worsens with breathing or coughing, fatigue, and loss of appetite. In older adults, symptoms might be less obvious. Confusion or delirium might be the most noticeable signs. If you experience any of these symptoms, it's crucial to see a doctor immediately. Diagnosing pneumonia methods and techniques. Doctors diagnose pneumonia based on symptoms, physical examination, and test results. During a physical exam, the doctor listens to your lungs with a stethoscope for abnormal sounds like crackling or wheezing. Chest X-rays help visualize the lungs and identify areas of inflammation or fluid. Blood tests can check for infection and determine the severity. Other tests like a sputum culture or pulse oximetry might be necessary. Physiotherapy plays a crucial role in managing pneumonia and aiding recovery. It focuses on improving lung function, clearing airway secretions, and enhancing overall breathing capacity. Physiotherapists employ techniques like breathing exercises, airway clearance techniques, and early mobilization to facilitate recovery. They work closely with patients to tailor treatment plans to individual needs and optimize outcomes. Section 6. Physiotherapy assessment for pneumonia patients. A physiotherapy assessment for pneumonia begins with a thorough review of the patient's medical history, symptoms, and current condition. The physiotherapist assesses the patient's lung function, breathing pattern, and chest mobility. They also evaluate the patient's overall strength, mobility, and exercise tolerance. This comprehensive assessment helps determine the most effective treatment strategies. Section 7. Techniques and approaches in physiotherapy management. Physiotherapy management of pneumonia involves various techniques. Breathing exercises like deep breathing and diaphragmatic breathing help improve lung expansion and oxygen intake. Airway clearance techniques such as postural drainage and percussion help loosen and remove mucus from the airways. Early mobilization, even gentle exercises in bed, can prevent complications like muscle weakness and improve overall recovery. Section 8. Do's and don'ts for pneumonia recovery. Pneumonia can be a serious illness, and recovering from it requires careful attention to your health and habits. Here are some essential do's and don'ts to help you on your path to recovery. Do get plenty of rest to allow your body to fight the infection. Rest is crucial because your body needs time to heal and recover its strength. Make sure to sleep in a comfortable position and use pillows to support your head and neck if needed. Avoid strenuous activities and give yourself permission to take it easy. Do drink plenty of fluids to help thin mucus and prevent dehydration. Staying hydrated is vital for your recovery. Water, herbal teas, and clear broths are excellent choices. Avoid caffeinated and alcoholic beverages as they can dehydrate you. Keeping a water bottle by your bedside can serve as a reminder to drink regularly. Do take all medications as prescribed by your doctor. It's important to follow your doctor's instructions carefully. Antibiotics, if prescribed, should be taken for the full course, even if you start feeling better. This ensures that the infection is completely eradicated and reduces the risk of recurrence. Do practice deep breathing exercises as instructed by your physiotherapist. These exercises can help improve lung function and clear mucus from your airways. Try to do them several times a day, and don't hesitate to ask your physiotherapist for guidance if you're unsure about the technique. Do gradually increase your activity level as you feel able. Start with light activities like short walks around your home. Listen to your body and avoid overexertion. Gradually, you can increase the duration and intensity of your activities as your strength returns. Don't smoke, as it damages the lungs and hinders recovery. Smoking can severely impair your lung function and slow down the healing process. If you smoke, consider seeking help to quit. There are many resources available, including support groups and medications to assist you in quitting smoking. Don't ignore persistent symptoms. Consult your doctor. If you experience symptoms like high fever, chest pain, or difficulty breathing, contact your healthcare provider immediately. Early intervention can prevent complications and ensure you receive the appropriate treatment. Don't push yourself too hard, too soon. Rest when needed. It's important to balance activity with rest. Overexertion can lead to setbacks in your recovery. Pay attention to your body's signals and take breaks as needed. Resting allows your body to heal and regain strength. Don't hesitate to ask for help with daily tasks if you're feeling unwell. Recovery can be challenging, and it's okay to seek assistance from family and friends. Whether it's help with household chores, meal preparation, or running errands, accepting support can make a significant difference in your recovery journey. Section 9. The importance of physiotherapy in pneumonia recovery. Physiotherapy is essential for pneumonia recovery. It helps improve lung function, clear airways, and enhance overall well-being. By working with a physiotherapist, patients can regain their breathing capacity, strength, and endurance more effectively. Physiotherapy empowers patients to actively participate in their recovery process and achieve the best possible outcomes. If you're recovering from pneumonia, talk to your doctor about incorporating physiotherapy into your treatment plan.